said in menstrual or like menopause or in pregnancy, all these,
Yeah.
there are a lot of hormonal changes
Correct.
happening.
Yeah.
So, like what does oral hygiene play in that? Like what kind of role does
Correct.
it play? Yeah.
So after the teenagers, again, what happens is the next phase in a woman's life is, of course, pregnancy. Now, during pregnancy, again, there is fluctuation in the estrogen and progesterone of the female hormones. Now, during this time, we see a phenomena known as pregnancy gingivitis. That is, the inflammatory markers in a woman's body increases, and she may get a tendency to developing gum inflammation, bleeding of gums, and that is why she should visit her dentist and get dental cleaning or scaling done and polishing done. Because now, again, there are many studies which are linking this pregnancy gingivitis to increase in BP of the women patients. Even premature deliveries can happen because of it, or even low birth weight of the babies. Another important thing that we see is when the woman visits the dentist during her pregnancy, we are often the first people to diagnose something known as gestational diabetes. Because of this hormonal fluctuation, a lot of women become diabetic for a short period of time. And when we inform them of this, they go rushing to their gynecologist, who is able to help them out with the medication for the same. Again, in perimenopause, we have these fluctuating hormones. There is a spike in cortisol level, which leads to increase in tendency to put on weight. And people are now worried about the semaglutide or the Ozempic, where people are getting very gaunt or very lean appearances on the face, known as the Ozempic face. We are also seeing, surprisingly, something called as Ozempic teeth. Now, what happens is the side effect of this semaglutide is that it causes a nausea and vomiting. Again, your vomit contains high level of acid. This again causes a lot of cavities and other issues. It can also cause gingival bleeding, which can cause gingival recession, a lot of bone loss. And this bone loss, if this persists and the people neglect it, you can even lose your teeth because of this.
Hi, Healthy Naaris. Welcome to another interesting podcast that we have lined up for you today. Today, from the world of dentistry, we have an amazing guest, and we're going to learn a lot about our teeth.
Please welcome Dr. Shambhavi Malik. She's an expert dentist in Jew and expert in prosthodontics and implantology. Thank you for coming and for joining us for the podcast.
Thank you so much, Adela and Sonal. It's a great honor and a pleasure to be a part of your podcast, Healthy Naaris. And I would like to enlighten you about a lot of topics dealing with dentistry.
So from starting, we want to know, how did you pursue your career in dentistry and especially in implantology and prosthodontics?
Yeah, so I'd like to give a little background about myself. I'm Dr. Shambhavi Malik. This is my 21st year of private practice at Malik's Multi-Speciality Dental Clinic, Juhu. And the tagline of our dental clinic is that it's family dentistry by a family of dentists.
Okay.
So both my parents are belonging to dental super specializations. My dad is an orthodontist, that is, he deals with crooked or malaligned teeth, that is a braces specialist. And my mother is a maxillofacial surgeon, which deals with any kind of trauma, infection, cysts, or cancers which of the head, face and neck region. So going by this background, you can imagine that right from childhood, I was always surrounded by these dental jargon and dental world. And because I'm an only child, they used to drag me along with them right from the age of 5 and 6 to all the dental conferences. So I've always wanted to be a part of their conversation, part of their discussions. And so I always jokingly say that I learned dentistry by osmosis. So that's how I actually began. And you would like to hear an amusing story that after my school hours, I would sit on the reception table along with my teddy bear or with my doll, and I used to give the same instructions like my mom or dad, as if they were patients. And even my parents' patients were very amused that a small 5 or 6-year-old child is giving perfect instructions.
Okay.
So that's how my journey began in the field of dentistry, and it was a given, and it came very naturally to me to enter into this dental world.
But then why implantology and those specialization, and what does it mean? What these specializations mean actually?
Yeah, so first you have to do your basics, which is your undergraduate study, that is a Bachelor of Dental Sciences. So I did my undergraduate study down south in Mangalore from Rajiv Gandhi University of Health Sciences.
Okay.
I give a lot of weightage to that because in the south your basic foundation is very, very strong. They pay a lot of attention to your basic sciences, and also from there I decided, and in the final year you get to choose your specialization. And later I decided to branch out into prosthetics and implantology.
So academically, like you have achieved lot of things in academy, and you have a lot of achievements. So what are the key milestones that did you face, like, you know, in this journey?
That's a little bit of an embarrassing question, and it sounds like I'm trying to blow my own trumpet. But again, I give a lot of credit to my school, which is Arya Vidya Mandir, Santa Cruz, wherein they paid a lot of attention to regular studies and, you know, weekly tests and didactic learning rather than last minute cramming. And this foundation, you know, helped in my higher studies. And so all these academics came very naturally to me. I am very fortunate that I'm blessed with a photographic memory, and also so much so that my teachers in my BDS used to tease me by calling me a human computer. So all this, you know, because in the first year itself I proved myself. I got a distinction in basic sciences, which is biochemistry and pharmacology, all over Karnataka. There was a distinction that was achieved. In the second and third year also I won the YMK gold medal for the highest marks. And in my final year again I topped and won the gold medal. And in that year you decide which branch you may choose in your masters. So once again I topped in 4 subjects out of the 8 at that time. That is orthodontics, maxillofacial surgery, pedodontics, and prosthodontics and oral implantology. And that is where the germ of my interest in this field actually started.
Okay.
And then I came back to Mumbai. I did my housemanship. I worked in Bhatia Hospital, Tardev, and there also gave me a lot of exposure of how to work in a hospital environment. And following that, I pursued my masters in prosthetics and oral implantology in D.Y. Patil University in Mumbai. And after that also I did my post-graduation and accreditation in dental implantology from Steinbeis University, Germany. But I believe learning is a lifelong process, and I love learning, and I think I will continue to do so till my dying day.
Can you tell our audience more about the specializations that you do? So
unfortunately in India, you know, dentists are clubbed only under one big umbrella. Even when I introduce myself in social situations that I'm a prosthodontist and implantologist, people go, what, you know.
Actually.
So I would just like to briefly tell you that we have 10 branches of dentistry wherein you can specialize. That is an additional masters. So after one finishes the undergraduate, that is the BDS, you can pursue a additional post-graduation, which is of 3 years. Okay, so this post-graduation can be done in oral medicine and radiology, which is simply diagnosis of the X-rays and the CT scans. Then there is oral pathology, that is people who get oral cancers or lesions. They are studied microscopically and diagnosed with the help of the oral pathologist. Then there is periodontology, that is a specialization of our gums. Then there is pediatric dentistry, that is dealing with children up to the age of 13 years. Then there is endodontics, that is a root canal specialist who only deals with you know, magnifying and correcting the nerve issues, or when patients come with excruciating pains and you have to undergo root canal procedures. Then of course there is orthodontist, which I've already highlighted earlier, that is a braces specialist. Oral and maxillofacial surgery also I've highlighted earlier on. And then there is very interesting even forensic dentistry, which is you know, pursued abroad. Wherein the dental records are very well maintained internationally. And using these dental records, the dentists help in criminal investigations. Like they can identify the dead bodies, or even certain victims who are undergoing domestic violence, etc. It can be proved with the help of bite marks, because the dentists have those records. So this is a little underdeveloped field in India. Okay. Now coming to my specialization, which is prosthodontics and implantology. Now you must have all heard of the word prosthesis. Now prosthesis is any kind of replacement of a missing part. And here it deals with missing teeth. So what a prosthodontist does is he or she restores the missing or broken down teeth, and he replaces the missing teeth, either with conventional dentures, which you may have seen your nana nadi, dada dadi wearing, which may be removable dentures, or they may be fixed type of dentures with the help of implants nowadays. Then there is the totally fixed implants to replace missing teeth. Then also involves use of cosmetic fillings in case you have chipped teeth, small gaps between the teeth. And also we now beautify the smiles with the help of dental bleaching. Then further modification of the teeth, of the shape and size, etc. can be done with the help of something called as dental laminates and veneers. And nowadays, in modern times, we have many brides and even sometimes bridegrooms approaching us for tooth jewelry. Where to enhance the smile before their big days. And there is something called as tooth tattoos also, for people who are into all those kind of things. So it is it is a vast scope, and it covers 40% of dentistry, which is why I chose this field over and above the other specializations.
But what kind of emergencies can you get in these kind of fields like?
No, emergencies are generally dealing with pain, and that management involves either surgical extraction of the teeth or emergency root canals. Now in prosthodontics, it is always pre-planned, and we have to study a lot into the dental x-rays, which I will be highlighting a little later.
So a lot of people do smile design and all those things for aesthetic reasons. So do you think that is realistic, or what kind of cases have you encountered? Do you want to highlight something?
Yeah, so now smile design or smile makeovers is rather the hot topic. All of us are becoming a little bit of social media obsessed, or into a lot of selfies. So we tend to highlight and look into our flaws a little with a magnifying lens. So teeth cannot be far behind in this game. And also in our entire Southeast Asia population, there is a growing population who are now become well-earning members. So those who miss the treatment in their younger age, they are opting for the smile design or smile makeovers with the help of either braces, that is conventional braces, which may be metal or ceramic, or with the help of invisible braces known as aligners. And also we can beautify the smile with the help of these laminates or veneers, or like I mentioned earlier, bleaching and other modes to improve your smile. Now smile design has many principles, because when we design a smile, we take the photographs of the patients, we take the videos of the patient to see how many teeth they are showing when they are smiling, when they are laughing, or even at rest, or even when they are frowning probably. And then we make molds of their upper and lower teeth in order to study them internally. And all this data is now collated into something known as a digital smile design software. Now this helps in aiding us in designing the smile, because I don't believe that everyone should have similar looking faces and similar looking smiles. So that is why designing smiles comes into the picture. Now what we study simply to understand is we try and align the facial midline, that is the midline of your nose and chin, to the midline of your front two teeth. So this is the basic criteria. Then we see the amount of pink and white display. But what I mean by pink and white display is how much of the gums you are showing at full smile or when you are laughing. Now in ideal smile, you would want to show only 1 to 2 millimeters of gums. And so if we do a smile correction, we do a gum surgery in order to modify this. And then next step, what we decide is the incisal edge, or the position of the biting edge of the upper front 6 teeth. Now, if you look at people who have beautiful smiles, this incisal edge will always follow the curvature of your lower lip. This gives a youthful appearance. Or if you may have seen certain people who have worn out teeth, or teeth with our frayed edges, this is what we call as a reverse smile line. And it follows the curvature of the upper lip, which makes you look older than you actually are. Okay, so these are some of the basic principles. Then also some patients may want to alter the color of their teeth. Okay, so the color of the teeth, again, I don't tell them, abroad there is a tendency to go for extremely white and bright smiles,
It doesn't suit
which
us.
is required in media. Okay, but here I help them to decide the color of the teeth based on the complexion of the patient. Then also and this can be modified by dental bleaching. Okay, and this can be done in 2 ways, either in office, that is in our clinics, or we can customize special trays for you, and we can dispense the bleaching agent given to you, and you can wear it at home. So this is known as at-home bleaching.
Okay.
The results of the second option will be a little slower. Whereas you do it in office with us, you can see a rapid change in the shade in a period of just 20 minutes.
Okay.
So it is best done before some important function, or if you're in the media, then those people come to us every 6 to 8 months for these dental bleaching procedures.
Okay.
And again, one more important thing we look into is the shape of the teeth. Okay, so the shape of the teeth, how will we determine? Based on the gender, that is, most women tend to have roundish or ovoid teeth, and men tend to have masculine teeth. So if it is a mismatch, that is, if you have inherited the teeth size and shape from your father and the jaw from your mother, we can correct this and help in achieving a more harmonious and beautiful smile. So these are certain basic principles of smile design.
Oh, never thought about smile so much. Yeah. But what is that laminate and veneer you were saying?
So you all know that we used to laminate our certificates. So a laminate is nothing but a film that is covering on the front surface of your tooth. So it is in actual contact lens thin, and it is stuck with special bonding agents onto the surface of the tooth. So we do a lot of enamel preservation with this technique. Now you would want to know what is the difference between a laminate and a veneer. So as a common man, we laminate our certificates. We are not changing the color of that certificate. It is clear. So when we don't want to change the color, it is known as a laminate. And when we want to change the size, shape and color, it is known as a veneer.
Okay.
But then we need to work on more than one teeth, because if you have only one, it will look odd.
Yeah.
So we need to work at least on the upper front 6 teeth in order to achieve symmetry. Now coming to symmetry also, we need to decide the size of the teeth, that is the height and the width of the teeth, with a very beautiful mathematical principle known as the golden proportion. Okay, the golden proportion is 1:1.6. Everything that appears beautiful to our eyes, whether it is an architectural marvel, whether it is a flower, or even a beautiful painting, follows this principle, wherein we decide the height and width of the ratio of these front 6 teeth based on this principle. So laminates and veneers are designed by using all these techniques.
Okay. Great. But have you faced any situation where people have set very unrealistic expectations from you, and you could not explain them that this is not possible, from smile design or any other concept? Yeah.
Yes, of course, there are many patients who have unrealistic expectations, and in our practice, we try to, talk to them, because ultimately it is a long-term result that we want to achieve. We do not want something short-term which is not going to help you in over the years, So we help them understand their own individuality. We help them understand the limitations of their own jaw, and then we decide along with them within those limitations what kind of result can be achieved. So we don't get into that zone of any kind of unrealistic expectations. Like I said, we have these softwares which help us simulating these smiles. Then sometimes we go one step further. We show them a mock-up of how the smile will look, either with tooth-colored wax or with tooth-colored filling material. So it is like a trial, like how when you're trying to customize a suit, you get trials. Similarly, we do a trial for them so that they understand and they can give us feedback, and they can also set their expectations a little more realistically. And like I said, in our practice, because I'm the daughter of an orthodontist, we try to follow biomimetic dentistry. Now, what I mean by biomimetic dentistry is that we try to mimic nature. I don't want to give everybody those cookie cutter smiles which ultimately look like chiclets, Like I told you, we want to customize it according to individuality, to a personality, so that it suits the individual. And that is why we follow a ABC principle. If the patient has enough time, we first advise them to do aligners or conventional braces, and that is naturally achieved without harming the integrity of your teeth. But of course, it takes a little longer span. You need at least 1.5 year to achieve a correct alignment with the help of braces. And then we do bleaching, like I explained, by changing the color of the tooth. And after these 2 stages, most of the people are happy with their smiles. And also they are ensured of the longevity of these smiles because we are not compromising the integrity. However, people who are little more in the media, such as actors, models, or even now people who are in social YouTubers, they often come to us and they want a quick fix. And they don't have that much time. They have to get ready before a shoot. We have many actors and models who have come in, who have been shortlisted for a particular movie or a web series, and they even come in with their directors and they are shot from every angle, and they try to dictate to us that camera mein ye angle se daant aise dikhne chahiye. So we have to compromise there and tell them realistically that we will have to reshape your teeth in order to achieve it in a short span of time. So it is all achieved. Smile design can be achieved with the help of laminates and veneers within a short span of 7 to 10 days.
Okay.
However, if you go by the conventional method of braces, it would take little longer. So we give the patient the responsibility of making the choice of whatever suits them best.
Alright, nice.
It's interesting. Okay, so when we talk about dentistry, now there's a lot of information coming out on how it adversely impacts health, your heart health, because all the nerves are interconnected. So can you shed some further light? Because people used to think going to the dentist is a one-off thing, or you wait till the teeth is completely ruptured, but it is harmful to your heart health at the end of the day. So
yeah, that's a brilliant question. And I would like to highlight that dentistry is much neglected, and it has a stepmotherly treatment in India, wherein people only come to the dentist in the last minute, when the alarm bells are ringing and when they are in extreme pain and they have sleepless nights. That's only when they remember us. But slowly and surely, like we highlighted smile design and aesthetics, we are moving from need-based dentistry. When you are in pain, it becomes a need, towards want-based dentistry, that is aesthetics and smile design. So in the need-based dentistry zone, I would like to highlight that your oral hygiene is very important. The oral cavity is in fact a gateway to your overall health, which most people do not realize. So whatever you're eating and drinking has to pass through this passage. So obviously it is going to have an effect. And now there are many international journals, there is a lot of research showing the links between overall health and overall dental hygiene. So most of your plaque accumulation, or if you don't get regular cleaning done, it has been associated with an increased risk of strokes, heart disease, and also Alzheimer's. So that is why timely and regular checkups are a must. And you should not be afraid of going to the dentist, because that is a little fear mongering, You should go and get a checkup so that you can catch whatever problem is there at a very early stage, so as not to allow it to escalate and result in disastrous problems,
Doctor,
and even because because even when you mentioned a heart condition, now many a times even a heart attack, the pain from the heart radiates to the left shoulder and even to the left jaw.
Yes.
So sometimes if we find that everything is right with the teeth, we often rush them to the hospital when we suspect that there is moving towards a heart disease. So dentists are very important sometimes in diagnosing these crucial things, like even for diabetics. When we feel that the gums are suddenly becoming inflamed red and they are undergoing a lot of changes and bone loss, we are the ones to push them to getting their blood test done, and it often reveals that they have become diabetic. So the dentists are actually your ally in this way, and they can help you even diagnosing your medical conditions and nipping them in the bud or taking adequate medications for the same.
Can you further highlight how dentistry and Alzheimer's, like oral hygiene and Alzheimer's, are interlinked?
No, so earlier, if you must have seen our parents or even our grandparents, they used to have silver fillings, or they used to have dental amalgam, as it is called, or they have to have Japanese gold teeth. So now all these heavy elements now they are always leaching into through our saliva into our human body. So nowadays it is totally banned in the Western world, but unfortunately in India it is still used due to the economic reasons, So we try to stay away from these heavy metals because of these side effects of Alzheimer and dementia, because there are now studies which are proving that these trace elements, which are, because they remain in your mouth for a good 20-25 years, you know. So there is some amount of leaching that does go into your bloodstream. That is why we try to move people from amalgam. We try to shift them to the tooth colored filling material nowadays, which is known as composite fillings.
Okay. So that doesn't go like into the, like that doesn't go like the metal
No, because there is no leaching of those, because heavy metals have a direct link.
tendency to leach.
Yeah.
Actually, let's segue into health. Since we're talking about the health topic, into women's health. But before that, I want to ask a very leading question. We use a lot of these oral, those gargling, what are they called?
Acha. Listerine and
Mouthwashes.
right?
What are they called? Mouthwashes, yeah. So we use a lot of mouthwashes, but recently there are a lot of studies come out that those might lead to cancer. So
Correct. So in our practice, we never allow our patients to use the alcohol-based mouthwash. If at all they have to use any kind of medicated mouthwash, it is done for a very short period of time.
Okay.
That is post the surgeries, wherein we need that antibacterial effect to at least be there, you know. So these alcoholic mouthwashes, what they do, if I don't want to name the companies, but they create an imbalance in the mouth between the good bacteria and the bad bacteria. So it changes the oral microbiome or the bacterial flora which is present in the body. There is good bacteria also present in our mouths, which is preventing caries. So this alcoholic mouthwashes are completely abolishing all the bacteria. And overuse of these mouthwash, especially in smokers and people with other habits, what it does is it even causes a gradual decrease in salivation. Now this decrease in salivation sometimes that leads to a condition, medical condition known as Sjogren's syndrome. With this, what happens is patients may even develop fungal infection or oral candida. So it is not only harmful to your dental health, because if your flora is lost, then again there will be an increase in the cavities also. And also our journals and publications and research that is going on internationally showing the link between this alcoholic mouthwashes to even colorectal cancer, prostate cancer. So it is better to avoid it. And
But
we
actually,
advocate.
a lot of people use it like as a mouth hygiene. But
Correct,
why
but
this-
now they are, like I said, now we are moving towards a holistic society, you know. Earlier we used to base our choices on a lot of commercials, on a lot of ads. But now people are more aware. They are more focused into their health. So it is a good idea to make a good choice, you know.
but why, like, if they're so detrimental, why are they so easily available?
Because of the marketing, you know, and the companies are of course financing these marketing campaigns which are brainwashing people into using these things which may or may not be good for you. Like I said, it is mandatory for a certain case or a certain short period of time. So it has a very limited clinical use and it is not meant for everyday use. Even if you use warm saline gargles on an everyday basis, that is good enough.
So let's talk about women's health, especially, and oral hygiene. So any interconnection between the both and how it affects, if you have a poor oral hygiene, how it affects women's health?
Yeah, I would like to applaud you all for asking this question because women's health, very few people speak about, and it is the need of the hour. So that's a brilliant question. Thank you for that question. And so, like I always say, our mothers are our first teachers, you know, so that is why it is very important that a woman of the house understands her responsibility in teaching all hygiene practices, especially this oral hygiene to the children, as well as motivating their husbands and other family members. Now, if the basic practices of correct toothbrushing techniques are done both morning as well as in the night, like I say very jokingly that in the morning we brush to keep our friends and in the night we brush to keep our teeth. So it is very important to brush in the night because 8 hours the bacteria are playing and they can create havoc. You know, most people skip brushing in the night. Then the use of flossing. Now what happens is brushing does not address the areas that are present between the teeth. So oftentimes the food gets stuck between the teeth. Now conventionally all over the world people use the thread flossers in order to keep these areas clean. But in India somehow we are not motivated to do so, or we are not taught this from a very young age. So another option would be the water flossers. If you've ever visited your dentist, you would notice that they have a jet spray which is attached to the dental chair.
Yeah.
So this water flosser mimics that jet spray.
Okay.
And it can be bought very easily over the counter. And what this does, it helps in flushing out the toxins. And also it can penetrate 7 millimeters deep below the gums.
Okay.
So any kind of food or any particles that are stuck are automatically flushed away by directing these water flossers at the junction of every teeth.
Okay.
So this is an important adjunct that women should teach their children and the rest of their family. Then of course we covered mouthwashing, that what kind of a mouthwash that should be used. So by doing this at any age, the woman's oral health and hygiene will be taken care of. But we as women face a very unique phenomena. We are subject or we are slaves to our hormones, unfortunately or fortunately, throughout our lives. So right from adolescence, when we start getting our menstrual cycle, we see that there is a hormonal rage that is happening, you know, the menstrual rage that occurs in all the teenagers, you know, they become a little uncooperative. So they may not brush or not maintain the oral hygiene. And that is when we start seeing that they start developing gum disease or cavities. And also I would like to further add that this phase between their teenage years, they should be motivated to visit the orthodontist. Because what happens, this is a growth spurt or a growth phase. So during this phase, we can harness the growth of that patient and use it to their advantage and align the teeth with the help of braces. Or with the, in our clinic, we also start from the young age of 6, where we use soft braces in order to guide the erupting teeth, the permanent teeth which are erupting in the jaw, by keeping away the forces of the tongue, the lip and the cheek, so as to avoid the full-fledged orthodontic treatment at a later stage. So do not miss this opportunity to treat your teenagers during this time.
But like you said, in menstrual or like menopause or in pregnancy, all these, there are a lot of hormonal changes happening.
Yeah.
So, you know, like what does oral hygiene play in that? Like what kind of role does it play? Yeah.
So after the teenagers, again, what happens is the next phase in a woman's life is of course pregnancy. Now during pregnancy, again, there is a fluctuation in the estrogen and progesterone of the female hormones. Now during this time, we see a phenomena known as pregnancy gingivitis. That is, the inflammatory markers in a woman's body increases and she may get a tendency to developing gum inflammation, bleeding of gums. And that is why she should visit her dentist and get the dental cleaning or scaling done and polishing done, because now again there are many studies which are linking this pregnancy gingivitis to increase in BP of the women patients. Even premature deliveries can happen because of it, or even low birth weight of the babies. I would go one step further and also like to highlight that if it is a planned pregnancy, the women, please do go and visit your dentist apart from your gynecologist. See that you iron out all your dental procedures before you're planning to get pregnant, such as your cavities, your fillings, your root canals, your extractions. Because what happens in the first trimester of pregnancy, we are not allowed to do any active treatment. We are not allowed to take x-rays without the use of heavy dental lead aprons. We are not allowed to prescribe higher antibiotics because we have to protect the fetus. So that is why it is best that you take care of your dental work before, in case you are planning the pregnancy. Another important thing that we see is when the woman visits the dentist during her pregnancy, we are often the first people to diagnose something known as gestational diabetes. Because of this hormonal fluctuation, a lot of women become diabetic for a short period of time. And when we inform them of this, they go rushing to their gynecologist, who is able to help them out with the medication for the same. So pregnancy is also crucial time wherein oral hygiene plays a very important role.
Okay. And what about menopause? Like, how is
now
that, like?
in fact, because of the society and the stress that we are living in, we have a rather long period. So I would like to divide it into perimenopause and menopause. So perimenopause can start right from the age of 35 and go up to the age of 50, where is the actual onset of menopause. So we have a very long span where we are in a little bit of a trouble as women. Again, in perimenopause, we have these fluctuating hormones. There is a spike in cortisol levels, which leads to increase in tendency to put on weight. You would find many women in this age group who are rushing to gymnasiums or trying to, get into fitness. And now there is the latest fad of using the semaglutide or Ozempic. Now you would ask how all this is linked to your dental health. So what happens is, in these weight loss fads, such as they start drinking apple cider vinegar, or they have nimbu pani on an empty stomach. So all these energy drinks, everything contain a very high acidic content, and that acidic content causes erosion of the enamel, again increasing chances of cavities. So I advise all my friends, my patients, or even the dietitians, if they have to recommend these supplements or these kind of drinks, please ask your patients to drink it with a straw, so that they are not in direct contact with the teeth. And again, people are now worried about the semaglutide or the Ozempic, where people are getting very gaunt or very lean appearances on the face, known as the Ozempic face. But we are also seeing, surprisingly, something called as Ozempic teeth. Now what happens is, the side effect of this semaglutide is that it causes a nausea and vomiting. Again, your vomit contains high level of acid. This again causes a lot of cavities and other issues. It can also cause gingival bleeding, which can cause gingival recession, a lot of bone loss. And this bone loss, if this persists and the people neglect it, you can even lose your teeth because of this. And another unique thing that we see in the middle-aged women nowadays, because we are living in a society which is full of stress, almost 10 to 15 patients every month we are seeing of the temporomandibular joint dysfunction or disorder. That means they get a lot of headaches when they wake up. They have a lot of stress that is in their jaws, or they get painful jaw joints. Just like our knee joints, we have a jaw joint here when we open and close our mouth, which is known as the temporomandibular joint. Now, any dysfunction regarding this also affects, we see it generally when this hormonal shift is happening, and also because of the stresses associated with midlife. So we help in alleviating this painful condition with the help of special guards. If they are grinding or clenching their teeth, then we give them night guards or bite guards. Or they have a true temporomandibular joint dysfunction or a problem, then we have special appliances to correct that as well.
Okay.
And another very important phase again is the menopause. So post 50, what happens is, once again your progesterone and estrogen will severely plummet. Now during this phase, again you have to up your calcium intake, consult your physician either if required, get your bone density scans done, and overall health. Because if this bone density scan is done, if this less calcium intake and osteoporosis or osteopenia can also affect the density of your jawbone. So that also needs to be considered. And during this phase, people may also get thyroid issues. Due to the thyroid issue also, it can affect your gum condition and cause a lot of bleeding, sponginess, and the sequence that I have already explained earlier on.
Okay.
So at every age of a woman's life, dentistry cannot be left far behind, and it needs to be considered, especially because hormones are constantly interplaying.
Changing,
So now we've covered women's health. Let's talk about dental care in our senior citizens. So like, how important is that, and what they should do? Because as you said, there might be bone loss and inflammation and all that factors come into play, plus weak health. So that's a very interesting question, and I feel a little sad about it, because in our country, our seniors do not mourn the loss of teeth. They feel God has gifted us with 32 or 28 teeth, so if one is lost, kya hi hota hai? So it is a very bad idea to not replace your missing teeth. So replacement of missing teeth, if they are unfortunately lost, should either be done immediately, would be very ideal, or within 6 months, because when we see our seniors, they keep on losing the teeth because of neglect.
neglect. And what happens is once the tooth is lost, the stimulus for the bone is lost. So the bones and the jaws keep shrinking. If you see our senior citizens, the nose to chin height is often collapsed or reduced because it is our teeth which maintains this height. So the tonicity of their skin or even the wrinkles are more obvious because of these factors. In technically we call this the vertical dimension. Now, so early replacement of missing teeth in senior citizens is a must, because what happens is if you extract the tooth, suppose in the lower jaw, okay, and you leave it like that for 2-3 years. Now, teeth are always on the move. It is not a static structure. So if you don't treat it or replace the missing tooth, whatever way, in whatever budget that you want to, either with a bridge or with a dental implant or with a denture, if you do not do so, the upper tooth will slowly start migrating in the downward direction and the space would get filled up. If that doesn't happen, then the back teeth start migrating forward. As a result of which, when these seniors come to us, there is barely any bone left to place the prosthesis, or there is less amount of space even to replace those missing teeth. Now, if this happens, say, I've given you an example of only one area, but if there are multiple missing teeth all over the mouth, this again takes a toll on our temporomandibular joint. So they get temporomandibular joint arthritis and temporomandibular joint changes that occur. So again, we have to treat them for that as well as restoring the teeth of these people. Another issue that we see is their oral hygiene habits also are not very, very ideal due to loss of dexterity. Or they may develop certain neuromuscular conditions like Parkinsonism. So like I said, they should use water flossers at least to clean interdentally between the teeth, or you try to switch them to battery operated toothbrushes just to motivate them if they do not have enough dexterity to give that time towards good brushing. And also a unique phenomena that we see in our senior citizens is we see something called as root caries or senile caries. So if they have been negligent of their oral health, what happens is the gums recede. Okay, and when the gums recede, there is a at the neck of the teeth, that is at the junction of the crown and the root, they develop these cavities. Or because of the constant food getting stuck between the teeth, like how we get cavities on the chewing surface. Okay, the senior citizens get cavity below the gum, which are not visible. So one fine day, if they have not gone for their routine checkup or they have never gone to a dentist, they end up with severe pain. So if they come in a timely fashion, we can salvage these teeth in the conventional way with the help of root canal and crowns. But if they are beyond repair and they cannot be salvaged, then we have to opt for extraction followed by replacement with either dentures or implants based on the bone condition and the budget. So I feel senior citizens should pay a little more attention to themselves, and the families should motivate them to keep up with their dental health as well as their medical health.
So coming to implantology, like what is that field about, and what are the common myths we find in dental implants, like if you could highlight that.
So if you can look at the model, a dental implant is nothing but a titanium screw or a fixture which is embedded in your bone. Okay. Now you may be knowing your orthopedic doctors who are placing these titanium plates and screws when the patients have fractures of their long bones. So titanium is a proven material. It is an inert material which is compatible and accepted by the human body. So a dental implant substitutes the root of the teeth. Okay. Now all of you all of course know that a tooth is made of two parts, that is the crown and the root. So the part which we cannot see and visible only in the X-ray is known as the root of the tooth, which is replaced by these dental implants, which is basically a titanium screw. Now what happens is, because it is a bio-inert material, the bone naturally grows into the threads of these screws over a period of time. If it is a young non-diabetic patient, then within a period of 3 to 4 months, the bone will grow into the threads of these implants and unify or become solidified into the bone. Or if it is a diabetic patient, then we need to wait a little longer for the healing to occur. Because as you all know, diabetics, the healing is a little slower. And then after that waiting period, or with the help of modern technology, if it is a front tooth, sometimes we can give the suprastructure or the crown in the same sitting or after the consolidation of that implant after a period of 3 to 4 months. That is, the next structure is known as the abutment. which mimics the crown of the tooth.
Okay.
And on top of that, we fix the conventional crowns.
Okay.
But these are implant supported crowns or implant supported bridges
Okay.
in order to replace the missing teeth.
Missing teeth. Okay.
Okay.
So it completely restores the function. It looks aesthetics. It is also very easy to maintain hygiene because they are almost like your natural teeth. Whereas the conventional dentures have to be removed and kept away in the night. So socially also it is more acceptable to have dental implants rather than the removable dentures.
But what are the myths about implants, like dental implants?
Yeah, like I said, many people fear dental implants because they feel a foreign body is being placed in their body. But like I said, it is a completely safe material. And also it is mostly done in our dental clinics under local anesthesia. So you don't need to get admitted unless there is a very big underlying medical condition wherein we would want to get admitted and do the procedure under general anesthesia. So basically it is very safe procedure. And the pain amount of pain or the instructions that you would have to be follow would be similar to that of a tooth extraction.
Okay.
And in today's day and age, dental implants are very precisely planned. So you do not need to fear it. Rather, you should go to your dentist and prosthodontist and understand what it entails and then make a conscious decision.
But how has the field of implantology evolved over the years? Like,
Yeah, the field of implantology is rapidly evolving. Now, like I said, we are placing these dental fixtures or implants into the jawbone. Now, we are now doing this with the aid of the CT scans. We have dental CT scans wherein we can envision the bone structure in a 3-dimensional form.
okay.
In an X-ray, we only see it in a 2-dimension. Now, why is it important? Because it is a screw. So our foundation is your bone. So we need to know the size and the height and the width of the screw. So how do we do this? We do it like an architect, that is with the help of the CT scan. We get to know how much of the bone is available and how much of the bone quality also is, what is the quality of the bone that is available. And based on this dental CT scan, we plan the type of implant, the number of implants and also the future design of your prosthesis.
Okay.
Now this CT scan data is, we again have a lot of softwares which help us in virtual planning. That means we can virtually do the procedure and see how everything will click and fit in your mouth before actually even touching you. So this is the correct use of technology to create precision. We can even go one step further. There is now in dentistry, we routinely use CAD/CAM, that is computer aided design and computer aided manufacture. We are using it for our dental crowns routinely and now we are using it even for dental implants. So what that does is, now first we did a CT scan, then we did a virtual planning, and based on this data we can now through CAD/CAM technology we can make a surgery guide or a template which can be fitted onto the existing teeth or onto the jawbone so that the placement is exactly precise and what we had planned on the software. So this further helps in greatly reducing the chairside time. So the patient's discomfort is minimized and also the surgical time is minimized. We as doctors we jokingly say that sometimes we can do a dental implant procedure faster than a root canal procedure because of all the pre-planning that goes into it. So it's time not to be afraid of it but to embrace technology and what it has to offer.
Can you tell us something that has happened during your course of dentistry, some unique story that has like really you've made a change to someone's life and someone's whole life has changed because of it?
So when we talked about smile design earlier, we only talked about the cosmetic aspect of it. But there has a lot of psychological impact also on certain people who are unfortunately born with certain defects. So we had a very unique case. If you look at his X-ray, you will get frightened because all his permanent teeth were stuck inside the jawbone and very few had erupted inside the mouth, what is expected in the adults. So he was this 18-year-old boy who had moved from Kolkata to Mumbai for his higher studies. And also he had another problem, that his lower jaw was reverse, that is the lower jaw was ahead of the upper jaw. Now if you see in the ideal model, the upper jaw is always in front and the lower jaw is behind. So we had to do a lot of rehabilitation work in this boy, because for 18 years of his life, he had never smiled, he had never eaten solid foods, he had no friends, he had undergone a lot of bullying. And so he was psychologically, he was under a lot of impact, and he was quite depressed when he came to us. So because we are a team with specialities in office only, my mother, who is a maxillofacial surgeon, she first corrected his jaw deformity, that is, she set back his lower jaw with a very specialized oral and maxillofacial surgery procedure known as orthognathic surgery.
Okay.
Now, why was this done? Because if I had to plan my future prosthesis or any caps or bridges for him, it would be unstable, because the lower jaw would keep trying to deflect them, and it would cause a lot of damage, and long-term success could not be achieved. So after his jaw surgery was done, we later decided to do his gum surgery in order to remove all the infected tissue. And then whatever teeth were present in the mouth, he had some deciduous teeth, that is, the baby teeth were also present in the mouth. We decided to keep them because there was no other option, because his permanent teeth were not fully grown in the jawbone, so they would never erupt. They were like in the bud stage only in the jawbone. So whatever teeth were remaining in the mouth, we tried to salvage them with the help of root canals. Whatever we could not, we had to sacrifice by doing extractions. And we did a complete, what we call as full mouth rehabilitation for this boy, wherein we replaced all his teeth with the help of crowns and bridges. And it was a life-changing transformation in his case. Not only did he gain self-confidence, he got a girlfriend, he began eating, he began smiling, and he is the biggest champion of our dental clinic. And so much so that when he went back to Kolkata, even his parents could not recognize him when they went to pick him up at the airport. So this is a perfect example of life-changing dentistry.
Oh,
You know?
amazing story.
And I like to also add that he is one person who never misses his biannual visits. And even if there is a small bleeding or a small ulcer, he will come rushing all the way from Pune, where he has now moved, because he is one person who knows the value of teeth, which unfortunately many people do not. So only what you don't have, you try and cherish.
Yeah. True.
Know the value of it. So, doctor, who is your idol, and how your parents shaped your career and helped you in this journey?
See, I'm a big fangirl of both my parents, because to me they are my parents. To the world, they are the stalwart, dental professors or teachers in the field of dentistry. And for me, every day has been a learning experience. And they are very beautifully managed to, balance their professional as well as personal life. My mom was always into academics and as well as the surgical aspect of it, and my dad was in private practice, so he used to always take out time to even pick me up or drop me to school. And when my mom was away teaching in the hospital, so I always sweetly say that I was mothered by my father and fathered by my mother. So I got the best of both worlds, and both of them could achieve their professional milestones without compromising on their personal life because of this equation. So I feel that's the best role model to have, whether in dentistry or in life.
So generally doctors don't believe in other kind of horoscope and astrology and all those things. So,
Pseudoscience.
Pseudoscience. So you being a tarot card reader as well, how come you believe in all those things, and what is the concept behind it?
Yeah, so that's a very interesting question. Like many people who are my tarot card clients, they often tell me that you come from such a scientific background. You have done your graduation and post-graduation, which is completely backed by science. So I would like to tell you that tarot also comes from a science. It is called as an esoteric science. Okay, so it is not, it is a belief system, like, jo mano so bhagwan. If you believe in it, it is God. But if you see in the medieval times also, tarot was derived from the ancient sciences, where people would want to communicate with each other even when language was not invented. So you see all the hieroglyphics or on the rocks, they used to have these paintings and drawings. So that was a way of communicating with each other. So that is the origin of these tarot cards, because tarot is not a pseudoscience, and tarot is very different from astrology. In astrology, it is based on planetary position. Now, why I like tarot personally is it because it helps you to channel your free will. Now, by free will, I mean that we know that certain things are destined, or if the astrologer tells us that ye hone wala hai. Whereas in the tarot card, it is like going to your counselor or to your best friend in order to seek advice. So it helps you moving in the right direction. Suppose a person who is looking for a job and they have given an interview in 2-3 places, they come to me and they ask me which is a better option. Then we can have see the cards and help in guiding them towards that way. Or if you feel that both of you all are going to, if we see in the cards that both of you all are going to have an argument or you all are going to have a tiff or a fight, then I can forewarn you that this may occur in so and so time period. So mentally you will also be a little alert, and what would have been a big argument or a big dispute would turn into a small trivial talk. And so this is what tarot does. And there is what I believe is forewarned is forearmed. That is, when we know of something, we can try and minimize the bad effects and try and work our ways around it and still be in a comfortable position. And that is the beauty of tarot. It is not prophecy, it is more about guidance.
So, Doctor, we would like to have a fun rapid fire round with you.
Yeah, sure, that will be fun.
One dental myth you wish people would stop believing.
Yeah, there's a lot of fear mongering associated with dentists. Like people tell they are, threaten their kids with our name, ki doctor ke paas leke jayenge, in order to make them do things. So I would like to say that fear, I've made my own acronym, that fear is nothing but false evidence appearing real. Now, modern dentistry is quite pain-free. We try to ensure that the patients are very comfortable. We have needleless injections. We have all the pre-planning and the technology to our advantage. We have single sitting root canals which can be achieved if there is not much of infection. So all in all, it is a very, very sound method in which we have exact devices to measure the size and shape of the teeth. So it is done in a very architectural manner right now, So that is why also we call our clinic, we have another tagline known as the Smile Architects, because we are planning things to such a large degree that the patient is not at a disadvantage. So I would urge all the patients to invest in your smile, because you wear it every day. We are very open to changing our hair or to changing our clothes or investing in those aspects which are seen in the external. But we forget our teeth. Because like we already covered that teeth, the oral cavity is the gateway to overall health. So please ensure that you visit your dentists biannually and don't fear them. So that is the biggest dental myth that I want to abolish.
Favorite dental tool?
Yeah, like there is the advent of technology. There is a lot of new technology and tools that we or gadgets that we are now using in our dental clinics. But I would like, at the end of the day, I would like to say that my favorite dental tool will always be, and it cannot be replaced with any amount of AI or any amount of technology, is the simple dental drill or the dental handpiece. Because what as the artist has the paintbrush, or a sculptor has a chisel and mallet, or writers like you all have pens, we have a dental drill wherein we can execute we can execute dentistry, we can relieve patients of their pain and also create beautiful smiles. So without the dental drill, we are nothing. So it is of course my favorite tool.
A daily habit that's a game changer for oral health?
Yeah, a daily habit that's a game changer for oral health is brushing in the night. Many people miss that.
Yeah.
I advocate, if you have a very job which does not allow you to give time towards your oral hygiene, then please switch to a battery operated toothbrush. But make sure that you are brushing at least 2 minutes, and use of water flossers, and flossing is mandatory so that you don't get cavities interdentally or between the teeth. And of course, I cannot again reiterate and say that biannual visits are the gold standard, because anything that we want to have for a longer period of time requires maintenance, whether it is our houses, our cars. So similarly, we need to pay attention to our oral health as well.
Actually, tea or coffee, which is more bad for oral hygiene?
Both are equally bad because they can cause staining, and nowadays there is a fad of having coffee or tea without milk, or green tea and green coffee. So these again cause a lot of staining on the enamel and discoloration, which is why then patients have to undergo bleaching. And our haldi laden food also doesn't help as Indians. So if you can have lactose free or lactose milk, I would always prefer to have the milky option. Or if you must have black tea, black coffee, I would. It would seem strange, but have it with a straw.
Okay. 3 foods that you should avoid generally in your meal to prevent your oral cavities. And
See, you always label that sweets are the culprit to cause cavities. We tell children also that. But the actual culprits are your carbohydrate-rich foods, which is your biscuits, your potato wafers, etc. All these carbohydrate-rich foods contain a lot of which ultimately break down and become sugars, which we don't realize. So you try and have a bank of these and give them to your kids only on special occasions as a prize, rather than indulging them on a daily basis. You try and inculcate habits where they have a lot of fibrous foods. We are seeing a lot of delay in eruption of permanent teeth because of the junk food consumption that is happening nowadays. So what teeth were to come at the age of 6, permanent teeth, are now coming at the age of 9 and 10. Because they are not eating enough fibrous foods. So try and move towards your salads, your fibers, your apples, instead of trying to give them other kinds of treats. You know, they can of course be given, but reserve them for a special time and date.
your personal wellness mantra.
Yeah, I believe in total body, mind and soul wellness. So for the body, of course, you try and go to the gym. And I try to do something which I enjoy. So personally, I enjoy spinning. And because as dentists, we are constantly bent over our patients. So we have poor posture. So for that, I try and do a lot of yoga or Pilates in order to improve my posture. And for the mind, of course, you try and do a lot of reading. And for the soul, I believe in chanting, as well as my other spiritual methods. So I generally believe in having a holistic approach towards my personal health.
So if you love this podcast as we did, please do give us a thumbs up, like, subscribe, share, and do comment what else do you want us to cover from Healthy Naaris.
Thank you.
Bye.
Bye.